welcome to this ET Now special. I'm Nayanthara Rai, working from home. On Independence Day, Prime Minister Narendra Modi from Red Fort announced the National Digital Health Mission. It is being seen as a game changer, something that can revolutionize the healthcare sector. I'm now being joined by the architect of the National Digital Health Mission, Dr. Indu Bhushan. You all know him well. He's the Chief Executive Officer of Ayushman Bharat and the National Health Authority. He is going to be responsible for revolutionizing the healthcare sector and digitizing it. Dr. Bhushan, I know you have a lot going on, so I must first up thank you for taking the time out, giving us time to be here a part of ET Now. Sir, I was so keen to interview you because there are so many questions that all Indians want to know. Let's take them one by one. Let's first begin with the unique health ID. Dr. Bhushan, I understand this is going to be by consent, it's going to be by voluntary, and doesn't have to be linked by Aadhaar. Take us through the details on how you will be issuing the health ID, hopefully to every Indian.
Thank you very much, Nayanthara, for having me on your show. Just a couple of clarification that I am not the architect of this whole mission. It was prepared by Ministry of Health with a lot of experts, and there was a blueprint prepared by Mr. J. Satyanarayana. And I am just one of the many implementers of this mission. This is a very complex mission where a lot of agencies are involved in this. Therefore, we are one of the many supporting the rollout of this mission. On Health ID, you're absolutely right. The aim is to provide unique Health ID to each individual, each citizen of the country. The reason being that we want to have a marker on which we can have their records, not we, the person should have their records, health records on their fingertips. I'm saying their fingertips, not anyone else's fingertips. They should have linked to any health record that is created, whether it is immunization, whether it is any lab report, diagnostic report, or they've gone to a hospital, then clinical report, e-prescription, all that should be available to a person. For making that available to a person, there should be a unique identifier across all these records. So for that to happen, we have to have that unique ID, health ID, and that is what we aim to give. And as you said very clearly, we are going to be starting this whole process with 6 UTs.
So you're beginning with the 6 union territories. In fact, there was a press release soon after the Prime Minister's address from the Red Fort. Dr. Bhushan, let's just talk about the health ID. It's going to be what, 14 digits long? What is going to be unique about it? Is it possible for an Indian to have more than one health ID, especially because it's not mandatory, and it's not mandatory to link it with Aadhaar either?
You're right. First of all, participation in the mission is voluntary. Whether you want to be part of it, whether you want to have health ID made, that is up to you. And we are hoping that everyone will create an health ID. You don't have to make it compulsory for something to be adopted. For example, all of us have cell phones, mobile phones, but it's not compulsory to have mobile phones, right? Still we do. So I'm hoping, and our assumption is that this ID will be so important that everyone is going to be having it. Now, you're also right that although we want to have a link to Aadhaar, but it's also not compulsory. We have a notification under Section 4 of Aadhaar Act by which we can ask for voluntarily ask for Aadhaar number, but that is not compulsory, and you can enroll through your cell phone as well. Third question, whether you can have more than one ID. While we don't recommend that you should have more than one ID, because that will create a confusion, that will lead to confusion about which records are linked to which ID. But in theory, one person can have more than one ID.
Okay, so now tell us, Dr. Bhushan, that once people start getting these health IDs, what happens next? So it'll be on their cell phone, or they'll have a hard copy, they can self-register, they can go to a healthcare facility and get it. So once they do that, what happens next?
Okay, so the life will become much easier uh, for patients and for doctors. How? If you have this health ID, you can go to a hospital and the registration process will be much simpler. And you would see when you look at all the patients which are lining up, they have lot of documents in some plastic folder or polythene bags. They have to carry that. You don't have to carry that because linked to your health ID would be your all previous records, very securely stored somewhere. And for doctors, uh, doctors will have, based on your consent, patient's consent, access to those health records, and they can provide treatment, they can prescribe any tests or other medication based on full information. Right now, often doctors have to be treating patients almost blind because they don't have access to what kind of treatment has been given in the past, what kind of allergies the person has, what kind of drugs or medicines don't suit the person. And many times, since there is no access to previous lab or diagnostic reports, doctors tend to prescribe some of them again, which leads to delay and, of course, cost. So here, doctors will have the whole record of the past and will be able to provide better quality services.
So, Dr. Bhushan, let me ask you in a very simplistic manner. I, Nayantara Rai, an Indian, decide to get a unique health ID. It'll
Mhm.
have my entire history. So then it won't matter whether I go hypothetically to a Max hospital, Apollo hospital, or AIMS. All my information you're saying is available with that ID, and any doctor I give consent to in any healthcare facility or hospital can access it. Is that what you're telling me?
Exactly. And the key word that you mentioned, Nayantara, is consent. Doctors can access the record only with your free consent, and you have the uh, option to give consent to only some records. For example, there are some records that you don't want to share, relates to something sensitive in the past. You say, okay, I don't want to share those. So these are the records I take can be shared. You can share records for certain time, say from 12 o'clock this afternoon to 4 o'clock, and after that, no access. You can withdraw the consent. Suppose you think that, no, that was a mistake. You can withdraw the
Okay.
consent. And also at the same time, as you would appreciate, we have the concept of delegated consent for children, for some elderly patients, those people who are not in a position to provide consent themselves, they can delegate it to someone, some caretakers. At the same time, there would be a provision of deemed consent. For example, if a patient comes unconscious and a doctor has to find out what the past records have been, past medical history, then doctors will have to give undertaking, and based on a protocol that we have put in place, they can access the record. Responsibility in this case will entirely lie with the doctor. So again, concept of free consent, then but at the same time there'll be a delegated consent, in some cases deemed consent. So that is the framework that we worked on for providing.
Okay, so this entire mission is going to be voluntary and by consent by Indians who want to be a part of the digital ecosystem, and consent and voluntary by the doctors who choose to be a part of this ecosystem. But from what you're explaining to me, Dr. Bhushan, a lot of the information is of course confidential, it's extremely private, and by one ID, whether it's a Max hospital or an Apollo or a Fortis or an AIMS, they can access all of that information. you're going to need a very robust IT system. So how have you already started rolling out? Is this information and data be controlled by the government? Is this going to be outsourced? Can you tell us how this is going to work? Or each healthcare facility, each hospital has to make its own system, but then they have to obviously link it with a central system.
Yeah. So the data is not going to be controlled by the government, and neither will the government keep this data. This data is going to be what we call it following a federated architecture where data should be available closest to where it was produced. Right now, for example, what happens? If you go to Max or Apollo, you have all your record there, and by law, hospitals are supposed to keep your record for at least 7 years because for future, if there's any future court case, for legally they are supposed to be keeping the record. So your record is there in most hospitals by law, and but in most cases it's not in digital form, and in most cases it's not retrievable quite easily because it's there in some files. Now, what is going to happen is that uh, all this data is going to be with hospital in digital form. And when I say now, of course, it will take some time because it's only the start of the process. And it will be there in a digital form in various hospitals. And you, as a patient, will have that capacity, authority, an option to either download all that data and store it somewhere, or just keep it there, and whenever you need it, you can have access to this data. So, but now we're not talking only about the hospital data. We're talking about all the public health related data. For example, and that too from birth till death. When child is born, within 24 hours, they're given, say, polio drug, or in 1 month's time, they're given various sets of immunization. And all that will also be part of this health stack where and linked to your health ID. And as soon as the child is born, along with the birth registration, we want to give the health ID so that every health intervention which is provided is recorded. And as you would know, Nantara, that in many schools, when you admit, you need to have immunization records. And many times you just have to go through old files to get those immunization records. But with the system, those records will be readily available, and by the agencies who have provided that interventions. And of course, like I was saying, you also have the option of pulling those data and keeping it in your digi locker or some vault that you can create.
So, Dr. Bhushan, you've explained it so nicely that basically, the endeavor being that when a child is born, there will be a unique health ID. All the information will be in one places. The benefits are, of course, very, very obvious. But Dr. Bhushan, and I'll come back to using myself as the example, Nantara Rai, as you have said, is the owner of my patient ID, my patient records, my medical history. Now, obviously, that medical history is also created with the help of the doctors I choose to go to. There will be this fear that, will hospitals be correct and ethical in allowing me to be the owner of my data? For example, I go to Max, I want to get a second opinion from Apollo, a third opinion from AIMS. Will I have to pay for that? Or I will never have to pay to access my own data?
Obviously not, because this is your own data, and it's the responsibility and obligation of hospital or lab or diagnostic center to provide your data because you paid for it. And what we're doing, which is unique here, is that even now all these health facilities have your data, but we are saying, or we'll be encouraging, that all this data should be in a digital form. But more than that, we're also prescribing standards so that it can be shared easily across all hospitals. What has happened in many countries, including the US, that they have a huge amount of data and all their records are digital, but their systems don't talk to each other because they are following different standards. So we are right from the beginning prescribing
Okay.
international standards which are interoperable. So that you can very easily get your data from Max and take it to Vedanta or any other place without any problem. Or you don't have to take it physically, but the systems will talk to each other. And going back to your original question, hospitals will not charge you for sharing data. But if you are taking data and keeping it somewhere, you might have to pay something to store that data. Government will provide some facilities which up to a certain limit, which will be free. But beyond that, if you want to store something like you
Yeah.
store it cloud, you'll have to pay for yourself.
And Dr. Bhushan, there will be phase one,
Yeah.
onboarding the doctors, which will also hopefully weed out a lot of those people. And I apologies for using the term, but I must, for the lack of any quacks, especially those that pretend to have certificates when they don't. So I'm guessing that this digital ecosystem will also weed out that huge problem that exists. We all have heard of horror stories of malpractices.
Yeah, absolutely. So we'll be certifying or giving the digital identity to only those doctors who are genuine doctors, confirmed by MCI or the new National Medical Council and state medical councils. So we'll give them facility for e-sign and e-prescription so that you can use that. And they'll also, once we develop the module for telemedicine, these are the digi doctors will be able to provide those services. And in future, we'll also be looking at e-pharmacy so that you can order medicines and drugs online based on e-prescription, and that will also be part of the system.
So then, Dr. Bhushan, you will first phase get the people the IDs that they want. That's going to be the first step, right? Have patients in a digital ecosystem. You'll get the doctors who obviously are certified. For the first time, you'll create a database and a repository of qualified doctors in that sense. Third step, I would imagine, will be the hospitals, the healthcare centers, the clinics, and all of that. You've already preempted by saying the next stage will be e-pharmacies, consultations, all of that. Dr. Bhushan, what about insurance companies, for example? Healthcare has started getting more expensive in India. Medicines cost more, for example. How is all of that going to be integrated?
It's a long journey. I always say that this mission is not a sprint; it's a marathon.
Okay.
And you're right that we'll have to first give health ID to individuals, doctors, and then facilities. And in the whole process, all three will actually benefit. Facilities right now, we've done this analysis which shows that about 67 certifications um, so there's 67 certificates required for a hospital to start functioning. And we are proposing that all of them, all certification agencies, registration agencies, can use the same platform and same data that we are going to be having on health facility registry, and use that data to provide those certification. And at the same time, we are looking at, we are talking to all insurance agencies and all government health insurance agencies like PMJ or Ayushman Bharat, CGHS, ECHS, that when they impanel hospitals, they should also use the same system to impanel so that hospitals don't have to provide different kind of applications to different insurance agencies. And for claiming, for submitting claims, we are going to be developing e-claim platform, and that e-claim platform would be used by hospitals to seek their claims from insurance agencies. Right now, hospitals have to submit different kind of claims forms, and that too in a paper form, and it takes long. It is very difficult to follow, process. Then the accountability will be very clear, and the claim submission will be also much easier. And that is another module that we are actually working in parallel under Ayushman Bharat that will integrate here so that all the insurance companies can also benefit from this whole system, both in terms of empanelment, but also in terms of payment.
So, sir, can you tell us a little bit about how it's going to work? Okay, so like for example, we have the NPCI and UPI in the payment system. So, what's it going to work here? Is your job going to be to make sure that the healthcare unique IDs are given, and then you will allow others to foster their own digital applications, come out with that? Or is there going to be done, because you said the government is not going to control the data. So can you tell us a little bit about how it's going to work? Are we going to have mushrooming of various platforms, for example?
Yeah. So here, you've taken a great example of UPI, so we are in this mission trying to develop that backbone or infrastructure where we'll have unique health IDs, we'll have IDs for all hospitals, we'll have all the electronic medical records, the standards for those all electronic medical records. And once this backbone is complete, we are expecting that a lot of private sector innovation and creativity will come in terms of preparing or developing apps which can provide different kind of services. For example, hospital management information system in terms of providing or tracking what is happening in the hospital. And that HMIS, Hospital Management Information System, can ride on this platform that we have created, and there will be a different kind of HMIS coming up. Similarly, for labs, those kind of software will come up. For doctors to provide services, clinical decision support systems will come up using our platform. For people to identify or find which are the good doctors close by, which are the good hospitals close by, those apps can come up, because apps can use and help or take data from us, and the publicly available data, and provide that kind of service. And we are going to be launching in a couple of days what we call a sandbox. And the sandbox is like experimental space where these developers can come and try to see what the system is and try to integrate their own apps and see how they can build this infrastructure.
But when you create the sandbox, Dr. Bhushan, one of the big problems that might exist, which didn't exist for the payment ecosystem, was that health is also a state subject. Is that going to be an issue at all?
Well, you're absolutely right. We'll have to get states on board. But again, I don't see why states will not be coming on board, because this is an initiative which is going to be improving the transparency of provision of health services, improving access to health services, improving accountability that health services have. It will be improving the clarity and access, because in many ways. So in that sense, it's a win-win situation. So we are expecting no pushback from states, but let's see how it goes.
Can I ask you one question, which is that, when Aadhaar is there, why can't your Aadhaar ID also be your health ID? Or you didn't want to link the two? What was the thinking? And I'm also asking this obviously because there are a lot of people who are always skeptical of data and infringement and all of that.
Well, we can't use Aadhaar for anything which is, we can have a limited use of Aadhaar. And that's the Supreme Court in its judgment on Aadhaar and data security has been very clear that use of Aadhaar has to be extremely, we have to be using that very carefully. and we can't store Aadhaar numbers without the consent of the holder, Aadhaar card holder, and there are security and privacy issues involved because with Aadhaar, other things also may be linked, and so it would be slightly difficult for us to use Aadhaar as the identifier for health as well.
So, Dr. Bhushan, so this is the sense I'm getting after this interview. So, tell me if I'm right. I'm going to try and now put it all together for the benefit of our viewers. And I'll again take my own example so that it becomes easier for people to understand. I'm Nayanthara Rai. I go on the website or the mobile application and I get a unique health ID. How long? This is going to be 14 characters long, Dr. Bhushan, and there will be a QR code, I would imagine.
Yeah, and also you can have an alias, like you can choose the name Nayantara at NDHM. So you can always remember it, and the system backend will link it to 14th ID, because I don't think many people can actually remember 14 digits.
You will be surprised at what all people have started remembering, but okay, that's great to know that we can use an alias. So I go on the mobile app or the website or whatever it is, or I take the help of a doctor. I get a unique health ID with, can have an alias as well. In my case, it can be Nayanthara Rai at NDHM. Now, Dr. Bhushan, I go, let's say I fall down. Touch wood, I don't, but supposing I do, and I go to a hospital. Then what? I have this unique health ID. Do I use that to book an appointment, or I reach the hospital and I'll have to scan it somewhere? What will be the scene?
Yeah, so you can use your health ID to register, because when you use that, all basic information that is already there will come up in the system. You can also, and it will also link any other things that are there already there in the system for you. For example, there's particular medication that doesn't suit you. You are allergic to some antibiotics. That will also be in the system, so they'll know that, and then they'll do your treatment, and whatever. Suppose you are sent for an X-ray. That X-ray will also be part of your health record linked to your health ID. And after that, suppose you were given a prescription for some painkillers, antibiotics, that will also be part of your health record. So the discharge summary, if you were, say, admitted, you are not, but if in the hospital for 2 days, and after that, discharge summary will also be part of your health record.
Okay, so that in a sub and substance sums it all up, and in the next stage will be e-pharmacies being onboarded, telemedicine being onboarded, health insurance companies being onboarded, and I would imagine even payment companies being onboarded, so you can even perhaps make your payment digitally and not worry about carrying cash. And there's always that problem also when you get hospitalized, you have to give a minimum amount and all of that. Dr. Bhushan, I'd like to thank you for being so patient, for answering all of our questions. It's been insightful having you. This is the National Digital Health Mission which is being rolled out. You're hearing it from the person who's executing it and at the helm of affairs. Thank you, Dr. Bhushan.
Thank you. Bye-bye.